Now we will see costotransverse joints. The tubercle of the rib, the tubercle of the typical rib articulates with the transverse processes of the corresponding vertebrae to form a synovial joint. So, costotransverse joint is a synovial joint which is formed by the articulation of the costal tubercle of the rib with a costal facet on the transverse process, costal facet on the transverse processes of the first through 10th thoracic vertebrae, and the last two ribs have neither articular tubercles nor costotransverse joints. Okay, so the costotransverse joint is a plain synovial joint. Okay, and this joint is covered by a capsular ligament, or we can call it as capsular ligament, and this one is strengthened by 3 costotransverse ligaments. So, and this joint is strengthened by 3 costotransverse ligaments. That means ligaments which are attached to the rib and this transverse processes. So we are having 3 costotransverse ligaments. The superior costotransverse ligament has 2 laminae. So this is the superior view, and the ligament here we are seeing is the superior costotransverse ligament, and it is having 2 laminae which extends from the neck of the this is the neck, so which extends from the neck of the rib to the transverse processes. So this is one laminae, and the next the inferior costotransverse ligament passes from the posterior surface of the neck to the transverse processes of its own vertebrae. Okay, and next one is the lateral costotransverse ligament, and next one is the lateral costotransverse ligament. That thing we can't find it, so this is present on the lateral aspect. This ligament connects the lateral non-articular part of the tubercle to the tip of the transverse process, So almost this side becomes the lateral costotransverse ligament, and this one is the superior costotransverse ligament, and another one is the inferior costotransverse ligament and the lateral costotransverse ligaments. These are the 3 ligaments which reinforce this costotransverse joints. And another important point you have to make a note on this joints are the articular facets on the tubercles of the upper 6 ribs are convex and permit rotation of the rib neck, so and permits the rotation of the neck rib and helps in pump handle movements of these ribs. That pump handle movements and bucket handle movements we will see in the next video, but you just make a note of it here. These upper 6 ribs permit a rotation of the rib. Okay, next one, and after that, so it may be up to 6 or 7. Sometimes in some books they have given up to 7. Okay, so in after 6th vertebrae, both articular facets are flat. So these articular facets are flat after 6 ribs. So from T7, where the gliding motions are dominating than the or rotation movements. So we have seen that in the costovertebral joints, all costovertebral joints having the movements called as the rotation and gliding. Here in the costotransverse joint, the upper 6 ribs, that is the upper 6 costotransverse joints, helps in the rotation at that joint, which helps in pump handle movements. From 7th to 10th, both the articulating facets are flat, which helps in gliding movements. That means up and down movements, which helps in up and down movements called gliding movements for bucket handle movements of the lower ribs. Okay, that pump handle and bucket handle movements we can see in the movements of the thorax. Okay, so this is about the costotransverse joint. And you have to note another point, that ribs 1 to 10 articulate with the vertebral column by 2 synovial joints, and with that of the manubriosternum forms the closed kinematic chain. That means the closed kinematic chain means the segments are interdependent and motion is more restricted. That means once a movement is taking place here, the movements are also taking place on the anterior aspect, like that. And the next one, the 11th and the 12th ribs, however, form an open kinematic chain and are less restricted. The alignment of the costovertebral joints and CT joints, that is the costotransverse joints, contributes to the downward sloping. So if you go back to that rib cage, you can see there is a downward sloping of the last 2 vertebrae, downward sloping of the ribs posteriorly. Okay, this is about the costotransverse joints.